Welcome to Sweet Talk. This broadcast is brought to you by the Continuing Education Workforce Training Division of Idaho State University's College of Technology. This podcast is part of our continuing outreach efforts, and the format is conversational. We will be having conversations with businesses, professionals, entrepreneurs, community agencies, and, in all cases, difference makers. Now, let's get started with Sweet Talk. Hello, everyone. This is Jason Batalden here at Continuing Education Workforce Training at the College of Technology at Idaho State University. And welcome to our podcast episode today. We have an exciting guest with us today. But before I introduce him, I got to welcome Gary back to the show. Gary, you've been gone for more than a minute. So I want to make sure that our audience, our 6 or 7 faithful listeners, are probably wondering where you've been.
Yeah, well, I've been letting the first team come in and take over, and you guys have been doing a magnificent job. Thank you.
Yeah, well, we're glad to have Gary on the show today. Paul is off doing important, busy things today, but as always, we want Gary on the show as kind of reminiscent of how this thing all started. So we're very good. Our guest today is Pat Kelly. He's the executive director, right? Pat, I got the right title, with Your Health Idaho. But before I go any farther, we've got to do that magic word, and the magic word is welcome. And as you know, when we say welcome, that's the 20-minute timer, and we get started. Pat, I kind of stole your name, title, and where you're with, but fill us in a little bit on everything else, and let us talk about kind of your position and what your role as executive director at Your Health Idaho means.
Well, thanks, Jason, and Gary, thanks for having me on today. Your Health Idaho is really, we've been around since 2013, and we talked a little bit before the show about the fight to get the state exchange here in the state of Idaho, and we're just super proud of the impact we've had in the state. It really shows how when you focus on Idahoans, finding a solution that really works for the state and most importantly for our citizens, that you can be super successful regardless of the politics that might surround you and swirl about you every day. We did serve almost 100,000 Idahoans each year in terms of our enrollment. In this latest year, it did go down just a little bit, and that was, of course, due to Medicaid expansion. But we're super proud of that enrollment. We're actually in the top 5 states in terms of per capita enrollment, and that's of all 50 states. And when you look at states that have their own exchange, which is what Your Health Idaho is, we're actually the top in the country for per capita enrollment. Again, that really shows how an Idaho solution is going to resonate great with the citizens.
That is actually, I really am glad to hear that. And me being always the cynic, Idaho isn't always known for being the top of a lot of things, but this is exciting to hear that in that area. So for just a little bit, Your Health Idaho, it's an insurance exchange. Can you talk just a little bit about what that means, maybe, especially for those of our listeners who might not quite, me for instance, may not have a full picture of what that is?
Yeah, great question, Jason. So, the idea of an exchange, think about an Amazon marketplace for health insurance. So when you log into or when you go to our site, yourhealthidaho.org, you can do a couple of things. You can shop anonymously. So that means you could enter your zip code, what your family looks like. Are you married? Are you single? Estimate your income, and it will tell you whether you get a tax credit. And we'll talk about that a little bit more. That's pretty exciting. And then it will also show you plans that are in your area. So plans that would be with the Fort Nook Medical Center, or maybe for your folks up in Idaho Falls that are listening in. So you would find plans that are not only in your area, but also would fit with kind of some of the needs that you might have. So as you go through that process, it may ask you what your prescriptions are, how many times you see a doctor, do you have any of those kinds of needs? So it really tailors that product for you. And to circle back on that tax credit, that's actually an opportunity for people, and we like to use this family of 4, earning say about $17 all the way up to $103,000 a year. So $17 an hour all the way up to that 100,000 mark, they may be eligible for a tax credit. And what that does is it reduces the amount of your monthly premium. So it actually helps pay for that health insurance on a monthly basis and really makes it affordable for so many people in Idaho. You may be thinking, well, do a lot of people qualify? And the answer is absolutely. Almost 9 in 10 of our enrollments receive that tax credit. And on average, it saves them about 80%.
Wow. Wow. And that's just new? That's always been here, the tax credit piece?
That has always been part of what Your Health Idaho does, yes.
If I can follow up a second here. You know, Pat, when you say a tax credit, and this is tax credit for the different health plans, do they all get the same kind of tax credit, or does it vary? And also, my experience has been, if you talk a health plan, that doesn't always mean like vision or dental or something else. And does that include this? Is that included with the tax credit?
So the tax credit is really based on your income and where you live. So, and what your family composition. So are you single, are you married, do you have kids? And then what's available in your area. And that tax credit is the same, really regardless of what carrier or health plan you choose. So if you were to choose Blue Cross or Select Health or Mountain Health Co-op, that same tax credit applies regardless of the carrier that you choose. Okay,
thanks.
And the question on dental or vision, yes, this is just for the medical coverage.
Just for the medical.
Okay. Gotcha.
So who looks up, who are the people that look up Your Health, look for these options plans? I'm assuming people who don't have maybe, health insurance either through their employer or through other, I don't know how many other places there are to get health insurance, but these would be people who have to get health insurance outside of maybe or unable to through their employer or those types of things. Is that who accesses or looks up Your Health Idaho?
Yeah, so our customers really are citizens of Idaho that don't have employer-sponsored coverage that are under age 65. So once you're 65 or older, it's you're eligible for Medicare. And if you have employer-sponsored coverage, of course, you can leverage that. Other than that, it's really people that are looking for coverage for maybe self-employed or people that are on early retirement or where their employer does not offer. You mentioned, like, how do we choose? There's so many options, and gosh, it's overwhelming, right? It's a really hard decision with lots and lots of nuances, and maybe people don't, kind of have that vocabulary. We have a great network of agents and brokers all across the state that people can work with to find that coverage that works for them. So Jason, you could go to our website, yourhealthidaho.org. You click on a button that says Find Help Near You. You'd put in a zip code down in Pocatello, I think it's 83201 maybe, and you would get a list of agents in your area, and you call them up. They'll sit down and help you go through the application process and also help you select that plan. The best part about this network of agents and brokers is they're absolutely free to use, Jason. You don't have any cost to use them. They're absolutely the experts, and they're all across the state to help.
So so that's a clear, that helps me understand a little bit. So when they go on yourhealthidaho.org, what they're getting is information, and then you're steering them to the people in their area who can help them, meet that specific need or whatever they're looking for. You're not buying the plan per se through yourhealthidaho.org. Is that correct? Or no?
Well, actually, when you're ready to enroll or when you're ready to apply for that tax credit, you do it via our website.
Okay.
So yeah, it's all within our website. If there's a section where you just log in like most websites, and you get to and that's where you do your shopping and your plan selection.
Very cool. And this came, you said, all back in 2013 is when this started. And, a little just, and again, with my elementary knowledge, but this kind of came out of the Affordable Care Act, correct? Is that where this impetus of this started?
That's right, Jason.
Right.
Yep.
Okay. And so then states are then, and then the Idaho decided that this was, that they needed to figure out how to come in compliance with the federal law. And this is what what was designed through the legislator, and I'm sure thousands of other people working on this. Is that how that came about?
Yeah, so in 2013 really was when our legislation was passed. We as an organization started a few weeks after that. You know, that was late March, early April. I actually joined in July of 2013. So I'm either crazy and I've been around that long, or, you know, having a lot of fun. I think it's more, probably a little bit of both, to be honest. But, you know, Governor Otter and the legislature really had this vision of, you know, local control, finding a solution that works for Idaho. They believed that we could do it better, cheaper, and at the same time keep federal intervention out of Idaho. And that was really our mantra, and we've lived it to this day, focusing on Idahoans, and we do it cheaper and better than any other state in the country.
And it's working, is what I mean, kind of what you said. It's working. It's doing exactly what it was intended to do, and people are getting their coverage, and they're providing that local control. And so, yeah, it's working. Kind of, I get them right. Yeah. Very good. So, kind of a little bit moving into this. You know, Gary and I were talking. Gary, I don't mean to steal your question, but we were like, who, like, are there certain populations that are, like your question, Gary, though, yesterday was like, our veterans, is who makes you eligible for this, other than just not having insurance provided by your employer? Is there other eligibility requirements along that way, or do you have to meet other certain conditions?
So generally speaking, you have to be a legally present citizen.
Okay.
Or a legally present individual in Idaho. So that's the biggest thing. Okay. There are some, you know, nuances in terms of eligibility. You know, even if your employer has coverage, but it's deemed unaffordable, you may be eligible for coverage via the exchange. But generally speaking, under age 65 without employer-sponsored coverage, and you'll be eligible on the exchange.
Very cool. That's as long as you are legally in Idaho, right?
That's correct. Yep.
Okay. All right. So a veteran could take advantage of this if they wanted to?
So, you know, I think the question would be if the veteran has coverage through the VA. So most places you wouldn't have dual coverage. Gary, unfortunately, it's just a little bit outside of my expertise in terms of that eligibility. But I think as a general rule, you can only have one type of government program. Okay. So if you have, for example, coverage through the VA, probably not eligible on the exchange. Just like if you had Medicare, you would not be eligible for coverage via Your Health Idaho.
Okay, well that makes sense. But just take it one step further. If a vet or any other population got coverage, medical coverage for something, but it wasn't fully covered, could this help that person get the remainder of the coverage?
Are you saying like a supplemental? Is the exchange a supplemental insurance?
Right. Is that something that this would help with? Could they search through this you know, Amazon example that you use and find something that could supplement them?
You know, Gary, I'm guessing that the answer is no. You know, one of the things about the plans that we offer is they're known as comprehensive coverage. So we cover what's called 10 essential health benefits, and every plan that is offered on Your Health Idaho has those same benefits. So think about things like, you know, wellness visits and those sorts of things. Every plan you can see via Your Health Idaho has that same benefit level. The difference, and they talk about metal tiers, and so think about bronze, silver, and gold. When you think about a bronze plan, it is much cheaper on a monthly basis, but it might be more expensive to use. But it has the same benefit structure as, say, a gold plan, but that gold plan is more expensive on a monthly basis, but less expensive when you go to the doctor, meaning your copays and your deductibles.
Sure.
So there are different plans to fit people's different needs, but all of the benefits are exactly the same.
Okay. Thank you.
So,
Yeah.
so Pat, jumping off a little bit, you've been with Your Health Idaho since the inception, 2013. I just a little bit curious. I read just a little bit on your website, so I'm not trying to stalk you, but your background isn't necessarily in insurance, so something appealed to you about this. And was it just the newness of it, or are you a glutton for punishment, or you know, how? Talk to me a little bit, just kind of your journey into where you're at this point.
Well, it's probably a little bit of all of those, Jason. So,
yeah, it's probably right. Yeah, yeah.
You know, at the time of my life when the exchange came to be, I was looking for something different to do, something fun, and I've always been attracted to things that were interesting and learning something new. So when the exchange opportunity came up, I thought, hey, why not? Let's see what healthcare is all about. I joined as the finance guy, as I like to say, and I think I'm still a recovering CFO in most days. You know, daily therapy sessions and
sure, right.
That
right.
sort
You
of
got a
thing.
support. You got a support group. You guys meet up once a week, that kind of stuff.
That's right. You know,
yeah.
My name is Pat. I have a problem. I was a CFO. You know, that sort of thing. But about a year after joining, so in 2014, our original executive director left, and I've been in this chair for the last 6 years. So, you know, the great thing about Your Health Idaho is we really do make a difference.
Yeah.
You know, we help people find health insurance, and many people never had health insurance before. The peace of mind that coverage gives you is remarkable. You can focus on your family, your kids, your education, your job. And many people just simply couldn't afford it prior to Your Health Idaho. That's a big part of why I'm still here. I also have a fantastic team. We're 55 people strong, and we have fun every day. We work hard, and we're focused on our mission. And that's a pretty hard combination to find in work, to be really honest. And that's why I really enjoy it. Right.
You know what? I guess you brought up the great point, though, right? Because this truly is, let me propose it as a question. Maybe I'm off base. I don't want to seem biased, but this is, at least in my opinion, one of those truly government-designed safety nets, right? That really do make a difference in the life of the average person. You know, because medical costs, and I mean, they could, you know, to assume some of those costs without insurance, you know, is life crippling. And this really does provide families that protection they need. You know, not just in daily care, right? In what is it called? You mentioned the term earlier, but just, you know, general care, right? But also in those worst case scenarios that we all hate to find ourselves in.
Yeah, you know, Jason, I think that's right. I mean, we talk about, you know, the wellness visits, the peace of mind, you know, being able to enjoy life and not worrying about some sort of, you know, accident that's catastrophic, both physically and also, you know, financially. You know, we have one of our ads early on was, you know, bones break and so do bank accounts. And I think, you know, that's true.
It is.
And in a lot of ways, we're here to make sure that doesn't happen.
Yeah, yeah.
Hey, Jason, one of the things we're getting close on time, I think, but one of the things maybe we ought to mention is there's a class on this that's going to be offered in the very near future.
Yeah, I suppose there's a connection here. Sorry, Pat. You know, like I said, we're not professional podcasters. You'd think we do this good, but yeah. So, you know, in your guys' mission, this is statewide, right? You guys carry this out throughout the state, and everyone who, like you said, lives in the state of Idaho. And so, one of the things is new to us this year is where this connection came. Is you guys we're hosting a class that you're offering September, I think it's at 26th, I think. No, October 24th, sorry, had the wrong date. People sign up and they can get some real specific information about Your Health Idaho.
That's right. And we do a number of different classes going into the fall. The next one for this is October 24th. Great opportunity for people who want to understand the process. How do I apply for health insurance? How do I see if I qualify for a tax credit? We'll walk you through the steps. We'll provide you with, how to find a broker or enrollment counselor in your area, and those experts that can help you complete the process. It's a small class setting. They are virtual and super easy and relaxed setting. People that want to, learn about what's next, because before we know it, open enrollment's going to be here.
Yeah,
so November 1st.
So November, right?
Yeah.
And they have a window. You would tell the end of the year?
That's right. So you can come out on our website after October 1st and you can see our plans that will be available for next year, but you can't enroll until November 1st. So November 1st is a Sunday. So log in on that first day. You can set up an account if you aren't a customer already, and you can start that enrollment process. That goes all the way through December 15th. And while that feels like a lot of time, we really encourage people to start early. I don't know, is there a lot of people that start and complete things early? There's a lot of procrastinators out there that like to wait till the last minute. So the more people we can get started early, give them that peace of mind and get that coverage set. Again, that's November 1st to December 15th.
Right on.
And they would roll on your website, right?
That's right. So yourhealthidaho.org. You'll see on October 1st, shop for plans, and you'll be able to see those plans. And then on November 1st, you'll see a button that says apply now, and that'll take you through that process.
Right on. And one real quick comment on that class that you're talking about. It's a free class, right? It's free, and it's virtual. And if you're interested in signing up through that, just check out our website at cetrain.isu.edu. And Gary, what's the name of the class? You remember?
Make health insurance work for you.
There you go. See? Make health insurance work for you. That is the name of the class on our website.
Yeah.
You register for that. You'll get a link. Sign up. You'll get up to the link, and you'll get the link to join the class on October 24th. So.
Yeah, registration's free.
So Pat, I'm going to be frank here. I did some research looking, and apparently I still didn't understand it. But your explanation of how this is an Amazon, right? That you go on and you shop and you meet your needs. I kind of got it. I think I had some holes still in my understanding, and that's kind of weird because, it's been around for so long, and I'd like to think I'm an educated guy, but I appreciate the information you brought to me today.
Well, I really appreciate you guys having me on, and glad we could help fill in some of the gaps on our website. And Gary, go check it out and see what plans are out there for you too.
I'm going to look at that. There's some other questions that come up. I might have to send you one or two separately. Okay.
Right on. Well, again, Pat, the website is
yourhealthidaho.org.
Okay, and that's the best way to get a hold of them. You guys also have local, through that website, get information, find help here locally. And I am just convinced that if you have any questions, the best place to start is there. And it sounds like you've got the team to get them straightened out. So with that being said, Pat, thank you for being on the show. Gary, it's nice to see you back on the show. I hope we got you on for a few more episodes as we get moving forward. Or maybe I need to step back and let you and Paul do it and really watch our viewerships take off, right? Maybe
let's get some new blood back in here. Let's get the new people back in.
That's what we need. So with that being said, everyone, please check out our website at cetrain.isu.edu. That is cetrain@isu.edu. Pat, thank you for being on the show. Gary, thank you for being here.
Thanks, Pat. Jason,
thank you, Gary. Thanks, Jason.
Have a wonderful day.
Bye-bye.